Democratic Party is calling for the dissolution of the Presidential Task Force on COVID-19 and demanding it be replaced with a convergence of experts in a special department under the purview of the National Center for Disease Control to professionally tackle the pandemic. The main opposition party in the country says it's distressed that the task force has not demonstrated any capacity beyond what it calls mere announcement of figures of infected persons, deaths, recoveries, discharges, and issues of local protocols rather than engaging in epidemiology, researches, and production of equipment, drugs, therapeutics, and other medical palliatives that can help stave off the impact of the global pandemic. In a press statement signed by the party's publicity secretary, Kola Ologbondiyan, the party alleges that the Buhari administration did not make any budgetary provision in the 2021 appropriation for the acquisition of essential therapeutics, including vaccines, even in the face of the heightened anxieties over the second wave of the pandemic in the country. The party has also accused the APC of using the pandemic as a corruption drain pipe. All right, let's put this in proper perspective. Joining me live from our Abuja studio is the spokesperson for the opposition People's Democratic Party, Kola Ologbondiyan. And thanks for joining us on TVC News at 7. Just last year, December, President Buhari extended the mandate of the PTF to March this year. We've seen that task force spearhead Nigeria's multi-sectorial and intergovernmental efforts curbing the spread of the virus. On what basis, really, are you calling for it to be disbanded?
Thank you very much. For us in the People's Democratic Party, we believe and we also know that most Nigerians also are in agreement with us that the Presidential Task Force has outlived its usefulness, if it ever had any usefulness before now. In the sense that all that we witness is announcement of number of people that has caught the disease, the number of fatalities, and just a demonstration of ceremony on national television. As such, the PDP is of the opinion and has also made demand of the federal government that we need experts in the area of epidemiology, in the area of therapeutic, and that experts in the medical field should be assembled and allow the Nigeria NCDC, disease control, to oversight such a group, rather than putting ministers or allowing ministers who knows next to nothing about medical to be parading themselves on national television.
Mr. Ologbondiyan, it is very interesting how you have beautifully belittled the effort of the task force in the past 9 months. I want to assume, or believe rather, that experts are working. Just 2 days ago, you heard the Vice President talk about Nigerian scientists submitting a proposed treatment drug to the WHO. But let us look at the figures. What the PTF has done is policy making. And I don't know if experts will be able to implement these policies given the many sectors that do exist in the Nigerian government. As we speak right now, Nigeria isn't even in the top 5 highest caseloads in Africa. We're talking about countries in Africa, over 6 or 7 of them that have more cases and more deaths in Nigeria. Are you saying that stakeholders like the PTF hasn't done anything significantly to have ensured that we are far, just a minute, Mr. Ologbondiyan, to have ensured that we are far from what experts have predicted would have happened when this pandemic started?
I want to assure you, and I expect that you agree with me, that the low level of cases in Nigeria is not predicated on the efforts of the Presidential Task Force. That would be a totally wrong assumption. Because in what capacity has the Presidential Task Force demonstrated its responsibilities in a manner to now allude to it the fact that we do not have a high level of spread. It is not scientifically based from researches done in our own party on the efforts of the Presidential Task Force. It's not correct. What we are saying is that rather than subject the process to administrative bottlenecks of government, allow experts who understand the situation to come and talk to Nigerians. It's not enough for politicians serving as ministers to parade themselves on the national television under the guise of reeling out casualties, of reeling out number of people who have been infected without any progress, and actually no plan for the ordinary people, just as we witnessed during the first wave. What the PDP is saying is that government needs to be more proactive. It needs to be proactive in attacking COVID-19.
All right, so I really don't understand what you mean by the involvement of experts, because the Nigeria Center for Disease Control has been actively involved with the PTF in the past 9 months. And we've also seen efforts by the Ministry of Health in this regard. But let us talk about the latest information from the PTF, asking that the January 18th day for school resumption remain untouched, even as we witnessed some sort of upsurge in the second wave.
Well, for us in the PDP, our reliability is on the position taken by those who are in the know. And that is why we are insisting that the disease control should be allowed, the Nigerian Disease Control Commission should be allowed to come and attend to the needs of Nigerians in respect of COVID-19. That is not enough for ministers to stand on the national television and be reading out figures of casualties or figures of people who have been infected.
Mr. Ologbondiyan, let's talk about what opposition parties like the PDP have brought and are bringing to the table. You mentioned earlier that you expect government to be proactive. What exactly do you mean by that?
What the People's Democratic will have done if we're in government will be similar to the manner in which we handle the Ebola, whereas we set up structures to monitor, to trace, to achieve purpose, both in terms of institution and even in manpower. But what we are saying today is that Nigerians are just allowed to resort to self-help. There is no corresponding effort from the government. And that's the position we are making. And if you leave the station and go on the street and ask questions among Nigerians, in fact, a large majority of Nigerians will no longer believe in the issue of COVID. And that's why when you go into the states, you find people not respecting the existence of COVID. As a matter of fact, a governor of a state, the governor of Kogi State, is saying that there's nothing like COVID. But of recent, we are witnessing deaths of people much more than we had experienced in time past. So that is why there's a call for concern.
Spokesperson, People's Democratic Party, Kola Ologbondiyan, thank you for talking to us.
Thank you very much.